We also want to share who our funders are. Wellness in School program is made possible by the Mental Health Student Services Act. And our really main objective is to support all the 19 school districts in Contra Costa County to meet the needs of their students' well-being. So this is one step that we are making sure that we are focusing our attention on our students and being ready to support them. We have a full agenda for you today. Please take care of yourself. Sometimes when we talk about suicide, it can be quite intense and triggering for some of us. So I want to make sure that you do take care of yourself and do whatever you need to be with us today. We have our presenters here, and I'm going to hand over the mic for them to introduce themselves. And I wish everyone a good learning today. I hope you're able to take away something with you, something new with you today. Thank you.
Well, hello, everyone. Good morning. My name is Mary Lucido, and I am one of the liaisons for the Wellness in Schools program.
Good morning, everyone. My name is Edmund Arnold. I'm a WISP liaison for West Contra Costa. I'm delighted to be here with you this morning. If there's any questions or anything, we do have our admin assistant outside, Moira, who can direct you to the restrooms if they're hard to find. I've been working here for 10 years, and I still have a hard time finding the bathrooms. It's like a maze up here. So excited to be here. This is something that's really passionate for me. We have a lot of information, so we're going to get through as much as we can, but we do want to go through some community and virtual agreements. And bear with us. Technology is not our strong suit. There we go.
Okay, so I'm going to walk us through our community agreements for the day. So starting off with confidentiality. So this is a confidential space, so we encourage you to be mindful of what you're sharing here with us today. Next, we encourage you to be respectful and judgment-free. We encourage you to stay engaged. As Edmund was sharing, there's a lot of information that we have here to share with you all today, so we really welcome your presence and your participation. Next, we encourage you to exercise self-care. So a lot of the topics and the materials that we're going to be discussing today are heavy and can bring up emotion. So we encourage you to step out if you need to, take a break if you need to. Please do what you need to do to take care of yourself. And then we will be using what's called a parking lot to answer any questions that you may all have today. The parking lot is featured over here. So you will notice on your tables there are sticky notes. So if you have any questions that manifest throughout the training, please go ahead and put them on the parking lot. And then this is a hybrid training. So we do also have agreements for our virtual attendees that are with us on Zoom. So first thing to note is that all attendees on Zoom will remain muted throughout the training. We are asking that if you are on Zoom to please use the Q&A feature to ask any questions that you have throughout the training. We will be doing a lot of interactive activities, and for that we will be utilizing the breakout room sessions for this. We are asking that when you are in those breakout rooms, keep it to a 4-person limit, and they will be assigned breakout rooms as well. And then again, please exercise that self-care, take care of yourself.
So before we get started with the suicide ideation, warning signs and risk factors, we're going to talk about what mental health is, and we're going to look at the Contra Costa data just to give you a better outlook of what's happening with our youth in the county. So the easiest, this is the mental health definition that we like to share with students, with new staff. We know that there's a wealth of knowledge in the room. We know that there's a wealth of knowledge that's joining us today via Zoom, but this is just the easiest way for us to define it. So just know that mental health affects how we think, feel, and act. It also determines how we handle stress, relate to others, and make healthy choices. If you have if you feel healthy in your mental health, then you know that it's better that you have easier ways to handle stress, relate to others, and make healthy choices.
And then I'm going to talk to you all about the youth mental health epidemic. So, mental health challenges are a growing concern for both teens and young adults. And so, we've compiled some data that we would like to share with you all. So, according to CDC data, 1 in 5 youth are impacted by a mental health challenge. More than 4 in 10, so 42% of students, reported feelings of persistent sadness or hopelessness, and nearly 1/3, 29%, experienced poor mental health. More than 1 in 5, so 22% of students, seriously considered attempting suicide, and 1 in 10, 10%, attempted suicide. And suicide is the second leading cause of death for teens and young adults ages 10 to 34. So, more on the data. According to the California Healthy Kids Survey for Contra Costa County, 31% of 7th graders, 37% of 9th graders, and 46% of 11th graders reported that within the last 12 months, they felt so sad or hopeless almost every day for 2 weeks or more that they stopped doing some usual activities. The California Healthy Kids Survey also revealed that 14% of 7th graders, 15% of 9th graders, and 18% of 11th graders reported that they seriously considered attempting suicide in the past 12 months. And the consequences of failing to address adolescent mental health conditions do extend into adulthood, and it impairs both their physical and mental health, and it limits opportunities to lead fulfilling lives as adults. And so we share this data with you really to stress the need and the importance to talk about suicide for the youth that we serve. And then this is the 2021 Youth Risk Behavior Survey. So in 2021, female students, LGBTQ plus students, and students who had any same-sex partners were more likely than their peers to experience poor mental health and suicidal thoughts and behaviors. Nearly 60% of female identified students and nearly 70% of LGBTQ plus students experienced persistent feelings of sadness or hopelessness. 10% of female identified students and more than 20% of LGBTQ plus students attempted suicide. Hispanic and multiracial students were more likely than Asian, Black, and white students to have persistent feelings of sadness or hopelessness. And Black students were more likely than Asian, Hispanic, and white students to attempt suicide. And so I really want to draw your attention to this bottom statistic that we have highlighted in yellow. Of all students with health insurance, only 14% seek professional help. So, looking at this data, I want to ask the audience, what comes up for you? How is this data sitting with you? And why do you think, out of the students that have access to health insurance, why is only 14% actually seeking professional help? Is there anyone in the audience that would like to provide a response? I'm going to have you speak in the mic.
They're pr- they're probably not accessing because they're afraid.
Excellent. Thank you so much. Is there anyone else?
No, we see a lot of cultural reasons for not addressing it, especially with parents. Students don't want to tell their parents because in their culture it's not accepted.
So, cultural reasons, they're scared. Excellent. Thank you so much. And I think I saw one more hand.
Yeah, I was going to echo that. Parents and families and siblings might find it shameful or a stigma to talk about such subjects.
Excellent. Thank you so much.
And then we do have some responses in the chat. We want to pass it to Kathy to just give us a couple of responses that we're seeing coming in.
Yes, so some participants shared that some may be scared to talk to their parents. Also, cultural stigma plays into an important factor. also embarrassment. Jen Lynn Whaley also brought up the lack of available mental health care workers in the community, lack of trust in the mental health profession, so cultural competency, stigma, trauma, perceived discrimination. Also, Dr. Miller said stigma, lack of representation in the mental health field. In addition, lack of knowledge and resources, and there is also a push of medication.
Thank you. Thank you. Wonderful responses. We appreciate you all for responding and letting us know why only 14% seek professional help. We heard a lot. It's due to stigma. So stigma is something that is really prevalent in our society, specifically in Contra Costa County. We see a lot of students. I've worked in classrooms for multiple years, and I often heard that students were afraid to go seek professional help because out of that, they didn't want their parents to feel like that they were doing a bad job. They didn't want to be looked at as less than others. I did not seek out professional help until I was 22 years old because honestly, I didn't want to be looked at as weak. I didn't want my peers to call me a punk, excuse my language. I didn't want my peers to just think of me as a weak person. So I did not seek out any professional help, even though someone pointed out that I may have needed help when I was in high school. It wasn't until I was a sophomore in college that I actually started seeing a counselor. So what is the definition of stigma? Mental health stigma refers to the clusters of negative attitudes and beliefs that motivate the public to fear, reject, avoid, and discriminate against people with mental illnesses. It is the use of negative labels to identify a person living with mental illness, and stigma is a barrier. Fear of stigma and the resulting discrimination discourages individuals and their families from getting the help that they need. The first person that I sought out for help was one of my school teachers because I did not feel comfortable going to my parents. My mother and father, great, but they often take what I say very to heart. They would seem as they were failing as their jobs as parents if I would went to them and said that I was suffering from mental health challenges. So my first person to really talk to me and sit me down was Mrs. Landis, my communications teacher in high school. So that's why we think it's so important to give these tools to teachers and all staff on school campuses, because students may feel more comfortable going to someone on a school campus rather than going to someone at home. We're going to watch a quick video just that's going to outline stigma. It's going to give us a better definition, and it's going to go over the historical impact. It's really quick. And you can use this with your classrooms. You can use this with other staff. It's just a quick 2-minute video to give us a better look at what stigma is.
You know that feeling where your thoughts scare you or make life tough? Sometimes it feels like no one else in the world has those thoughts or feelings. No one seems to know how difficult it is to deal with your feelings. And it's not easy to share your deepest secrets. You might think something is wrong with you. Or you might worry what other people think. And all of that makes your thoughts and feelings worse. Our culture has created this environment of shame. Until the 1960s, society sent people away if they had challenges managing their thoughts, emotions, and behaviors. Over time, we learned that we didn't have to be afraid. We learned how to help people get better. We became hopeful. But there are remnants of those images in our culture today, which is why some people still feel uncomfortable talking about it. The stigma has taken new forms too. With more access to more people all the time, it can seem like the world is telling us it's not okay to be anything but perfect. The truth is, everyone has thoughts or feelings that can be hard to deal with. So why do we make it so difficult on ourselves by judging others who could be going through the same challenges we are? What if, instead of seeing labels, we saw people who are struggling and could be there for them so they didn't feel so alone? What if we looked past our fear of mental health and started to talk about it in a constructive way? What if, as a society, we used empowering words and healthy images to help people feel supported? Maybe then, more of us could feel comfortable telling others when we're having a hard time. Maybe more people would get the help they need. And maybe one day we won't have to talk separately about mental health and physical health, but just health. The truth is, each of us has the power to change our culture. Will you join us? Share this video with a kid, your neighbor, a friend, and help us break the stigma of mental health.
So I love that video for a variety of reasons. It's really accessible for our students. And I also love how it goes over how in the past we used to use your name words such as insane asylum, and how it's shifted over time to be more behavioral health services. And I think that just by the way we talk, language is always shifting and changing. That we have to be very mindful of how we speak about mental health and how we talk about it, because I think the more the better language that we use, the more accessible accessing mental health services will be to our young people and to everyone that we work with. So we are going to have an opportunity to share out here. If you're here, I'm sorry we have to have you speak on the mic, but we do have to have you speak on the mic. I know that causes anxiety. I'm having anxiety right now speaking out the mic to you all here. But just know that we have to have you speak into the mic so the people online can hear you. So we are just going to have a share out, and then anyone in the watching virtually, please let us know in the chat what you think. But what are your thoughts about the video that we just watched? Does anyone want to share any thoughts that they had while watching this video? I know it's early. Do we have anyone in the chat that shared anything of their thoughts? Okay. Well, what about how can you address mental health stigma in your curriculum, your classroom rules, or your classroom or your school policies? Does anyone have any ideas? Thank you. Thank you for saving me.
Well, I don't actually work in a school setting, but I do work and link people into mental health services. But one of the things that I do stress while giving my presentations is that these services are very confidential. And they have a right to privacy, and we don't report to anyone and try to make them feel as comfortable as possible with coming forward so we can then give them the services that they need. So just stressing that confidentiality and letting them know that this is only going to be between me and them.
I love that. Confidentiality often means safety for some people. They don't want that getting out. I know that when I kept a lot of stuff inside for myself because I didn't want my friends or anyone else to know. So thank you for sharing. Anyone else? How can we address mental health stigma in curriculum, classroom rules, or school policies? And if you're in the community and you're doing other services, what do you do to address mental health stigma? Thank you.
Good morning, everyone. I think looking at it through the district lens in terms of school policies, for example, is making sure everybody is consistent and aware of the policies and practices in order to support students when there are signs, whether it's on low level or something more transitive or substantive. We want to make sure that everybody's on the same page.
Thank you. That's why training is so important, training our staff, bringing in resources for our staff to be aware of that, and then making sure that our school policies and our district policies are known and accessible for everyone on campus. Thank you for sharing that. Anyone else? Thank you. We'll take one more. You guys are saving me, making me feel good. Thank you.
We do a suicide awareness training with our 7th graders every year. And one of the things that I really love about it is when I was a kid, we didn't talk about suicide because it was, that stigma that goes with it. And it was like the no word. You couldn't say it out loud, like you were going to make it happen. And now we talk about it. So kids understand that it's okay to say the word and just tell someone you're worried about someone else or yourself. And then one of the things we do at the end of our little training is we have a little questionnaire that kids fill out, and we ask if they need to talk to someone or if they're concerned about themselves, but also, are you concerned about a friend? And so we make it okay to say, it's not just you, like you don't have to just worry about yourself, but you can also be concerned about someone else, and to let a trusted adult know.
You took the whole second half of our training today. Thank you. But yes, just and starting early, right? 7th graders. And I think there's a lot of stigma that if we start too early, we'll be triggering young people. But we have to start with our elementary school students. We have to start the training with our middle school students, because the more we do to raise mental health awareness, the more safe our students will feel as they grow. Thank you for that. And do we have any responses in the chat? We can maybe take 2.
So I really like the video. I like how it normalizes. Oh, I lost my train. Oh, I like how it normalizes mental health and gives the history on how we evolved in our health. Also, it's imperative for adults to build relationships with students so they feel more comfortable confiding. I really like the statement how one day we can talk about just health, not physical or mental. That's all important and okay to talk about. Um, I'd love to see training for educators on creating emotional safety in classrooms and SEL in the classroom.
Thank you. Thank you for everyone for contributing, and thank you for saving me in this room. I appreciate it. So we're going to keep moving on. We do have an activity.
Yes, so this brings us to our gingerbread person activity. Very shortly here, we will be putting a poster with a gingerbread person on each of your tables, and you'll be able to utilize that for this activity. For our virtual attendees, you will be assigned to breakout rooms. Again, it will be four people to a breakout room, and you'll be able to connect with your groups for this activity. So we are going to allow 7 minutes here. But with your groups, you're going to go ahead and address the following question. What have you observed that indicates your student may be having a mental health challenge? So think about, what do those challenging behaviors look like? Go ahead and take the next 7 minutes or so to go ahead and write those inside of your gingerbread person, and then we will come back, regroup, and share out. Just a 2-minute warning. 2 more minutes and then we'll come on back and regroup. Okay, we are going to go ahead and wrap up and regroup. So I heard a lot of great conversations, and I would love to do a share out now and hear what some of your groups have come up with in terms of what those challenging behaviors might look like. Is there anyone in the audience that would like to tell us what their group came up with?
So our gingerbread person had a couple of like social anxiety, isolation, depression, anxiety, drop in attendance, recent substance use, lack of communication from our support system or their support system, and lack of emotional or social connection.
Excellent. Thank you. Is there anyone else that would like to share out? Yeah.
Just in addition to the like self-isolating, pushing people away, but even like cruel language, hurting people's feelings, using strong language or foul language to kind of test even the adults, like what are you going to take seriously, or just attention seeking behavior, all kind. And I think a lot of stuff we had was similar to that poster. So.
Yeah, that's excellent. Thank you. And is there anyone else here in person that might like to share? No? Okay. And let's pass it to Kathy. Do we have anyone in the chat box from our virtual attendees that might like to share? Okay. No problem. Well, I really appreciate your participation. And so now that we've talked about what those challenging behaviors look like, we can now move into our next portion where we're going to really talk about the early indicators. So those early indicators of mental health challenges in students. Okay, and so what does this look like? Well, it can look like sleeping in class, defiant or disruptive behavior, refusal to participate in school activities, excessive tardiness, not turning in homework, failing tests, or failing grades, fidgety or restless, distracting other students, isolating, frequent absences, refusal to do schoolwork or general noncompliance, inability to concentrate, and lack of energy or motivation. And something that I do want to point out here is that if your students are feeling this way or experiencing these things, that there is hope and help available. And this now brings us into our next portion where we're going to talk about the risk factors and warning signs for suicide. So, risk factors, they are unhealthy behaviors, compromised coping skills, and negative aspects of a person's home and school life that increases the likelihood that the student may hurt themselves. Now, risk factors do not mean that they will hurt themselves, but it's a rather an indicator that the student is at greater risk. And so let's talk about what some of those risk factors for suicide look like. So you have students who previously attempted suicide or may have known someone that died by suicide. We have students with a mental health concern. So students who are suffering from psychiatric problems, they often have distorted views of themselves and their environment, and this can increase suicidal thoughts or behaviors. We have victims of abuse or harassment. So for an adolescent, avoiding loss of face is a major risk factor. And a student who feels humiliated by embarrassment, exposure to bullying, whether that be in person or online, or social isolation is at severe risk. And then we have students who harass or abuse others. And we have students who identify as LGBTQ+. So students who are questioning their sexual orientation or who are isolated or attacked for being gay, lesbian, or transgendered, they are at high risk for suicide, especially when they're in an unwelcoming or unaccepting environment, and again, whether that be at home or at school. And so more on risk factors. So we have students who abuse alcohol and other drugs. So self-medicating with alcohol and other drugs, it is common. But often doing so will increase those thoughts and feelings of suicidality. And actually, more than 50% of teen suicides do involve drug and alcohol use. Next, we have students who are highly aggressive or impulsive. So students who are quick to act, who have difficulty thinking things through, they are more prone to suicide. And so things like decision making, problem solving, conflict and anger management, these are all strategies that are going to be really essential for those students. Next, we have perfectionists and high achievers or potential dropouts. So students who are perfectionistic are typically overlooked by adults. And because they excel in so many areas, adults may not pick up on the fact that there actually could be an underlying emotional issue. And so these students will often avoid what makes them feel unsuccessful, but then they feel like there's no way out, and then they become at risk for suicide. Then we have students who are dealing with a recent loss in the family, and this does also include pets. And then we have students experiencing stressful life events and trauma. So, for example, maybe it's divorce, separation, a move, maybe a parent losing a job, or homelessness. And so these unpredictable life events can lead to insecurity and increased risk. And then finally, we have students who do not have a trusted adult to go to for help. So students will sometimes confide in their friends and avoid adults. And so things like stigma and embarrassment, they often impede a student's willingness to assess services. And there are some cases where students' concerns are discounted by adults, and then they are unable to access care. And so again, I want to stress that these are risk factors. It does not mean that they will hurt themselves if any of these are applying to them, but it does indicate that they are at greater risk.
Thank you, Mary. And it's really important for us to know the risk factors of our students because it's really important for us to have a process to identify these students so that we know that these students, we have a process to get them the help that they need from a school counselor or a school psychologist or an outside resource. So now that we know the risk factors, we just want to go over some of the warning signs and just know that warning signs are changes in a student's behaviors, their feelings and beliefs about oneself that are maladaptive or out of character and place them at risk for suicide. While these warning signs vary from individual to individual, some common traits have been observed in individuals contemplating suicide. And if you observe any of these signs in one of your students, you should immediately contact your school social worker or psychologist. And just to go over some of the few warning signs, so expressions of sadness and or hopelessness. So we know that these students are the ones that are in the classroom that say, I don't see the point of this. Why do I need to be here right now? If I was dead, then my parents' lives would be easier. They just don't see the light at the end of the tunnel. We have expression of wanting to harm themselves or die. So these are the students that tell you straight up that they don't want to be here anymore. They're thinking about killing themselves. These are our students that our younger students may not have the vocabulary to express that. So we might see this come out in their English assignments or their art assignments where they're saying that they're contemplating not being here or they don't want to be here anymore. A major change in affect or appearance. So I saw someone put in the chat, so lack of hygiene. So our students who are usually clean, usually will have really nice clothes. You see them just not really taking care of themselves lately. That's an indication that something's going on. Our students are the younger ones, particularly that are often going into the nurse's office, and we can't really indicate what's going on with them. That's an indication that something's going on. And then our students who suddenly show up as euphoric one day. Those are the students that we really need to be mindful of. A major change in behavior. So any students that we see that are usually have good academic performance and we see them suffering over a course of time, that's usually an indication that something's wrong. Our students that have a heightened sense of aggression, our bullies, our students who are usually not as aggressive on the playground, but we see them expressing themselves more aggressively. Any students who are our social butterflies are they start withdrawing for peers. So like these are our students who are constantly playing with others, our students that are also often like included in groups, but now we start seeing them slink off by themselves in the corner. They're walking around the playground by themselves. They're not engaging in the same activities that they used to. And then social isolation relates to that also. Another major change in behavior that we see, so it's very important for us to cultivate safe spaces in our classrooms because some of our students will give away their prized possessions. Some of our students will even indicate on social media, such as TikTok. I don't know what else is popular right now, but I know TikTok is, that they don't want to be here anymore. So you may not see it yourself, but a friend might see it, and a friend might come and report that, hey, my best friend just said something that's making me feel uncomfortable. They're indicating that they don't want to be here. So that's something that we need to make note of. And then our students who are struggling with routine. So these are the students who are constantly turning in their homework on time. Our students that don't necessarily get agitated when there's a sudden change in sudden change in the schedule. Our students that are having like a meltdown if there's a substitute for that day. So those are also the students that we need to make note of. And just know that some of these warning signs we want to make sure that if it's noted for a couple of weeks, because usually if we see it for a couple of weeks, that's an indication that the student is suffering from depression. So we have this in your pack of resources, but this is just a really good one pager that we like to share with teachers so they can keep it on themselves. So just know any differences in talk. So if a person talks about killing themselves, if they're feeling hopeless, they have no reason to live. They feel like they're being a burden for others. So if I wasn't here, my parents' lives would be so much easier. They feel trapped in their life right now, or they just experience an unbearable mental pain. Any behaviors. So we do have increased use of alcohol or drugs. I know that there's a stigma around students who use alcohol and drugs. In my experience, or students who use alcohol and drugs aren't using it for fun. They're using it to self-medicate themselves. They have no other way to feel better except utilizing that drugs and alcohol. And like I said earlier, withdrawing from activities. So our students who are really into football, they just love Brock Purdy. They're always talking about Brock Purdy. They're always talking about the 49ers. And then one day you see a sudden dip. They don't talk about football anymore. They're not engaging in football at all. That's an indication that something's wrong. Isolating from family and friends, visiting or calling people to say goodbye or goodbye messages, and writing, text, or on social media sites. We also want to take note of history. So if there's a mental health history, we want to make sure that we have those kids identified so that we know that we can give them the appropriate help that they need. Any previous attempts or any events such as a loss of a loved one, a traumatic event, or bullying. And also mood. So if we see a sudden change in mood, so if we see a student experience a heightened depression, any anxiety, loss of interest in the activities that they like. Irritability is mine. I get very irritable when I know that I'm in a low point. I will cuss you out in a second. Any humiliation or shame, agitation or anger, or relief and sudden improvement. Like I talked about euphoria earlier. Sometimes our students who know that the end is coming for them, they will come up with a certain euphoric experience. They are really happy out of nowhere. That means that they're thinking that they're not going to be here tomorrow. It's about their pain is about to end soon. We're going
Thank you so much, Edmund, for walking us through those warning signs. And so now we're going to move into a video here where we're going to look at teen suicide prevention. And this video was provided to us by the Mayo Clinic.
I have my ups and downs, just like anybody else.
Maybe more than anybody else.
I can be hard to figure out.
And I like my privacy. I don't want you looking over my shoulder all the time.
But you know your kid better than anybody else. And if you think he's acting different than usual,
Acting really down, crying all the time for no good reason.
or getting really mad, not able to sleep, or sleeping too much,
Shutting her friends out or giving her stuff away.
acting reckless, drinking, using drugs, staying out late,
Suddenly not doing stuff he used to love.
or doing stuff that's just not like him.
It might be nothing to worry about. It might just be high school.
Or it might be something more. He might be depressed. Not just feeling down, really depressed.
It might be that your kid is thinking about killing himself. It happens. More than you think. More than it should.
And people say, I had no idea.
I thought it was just a phase he was going through.
I never thought she'd do it.
I wish he'd come to me.
I wish he'd said
I
something.
wish I'd said something.
When it's too late. So if you think your kid's acting different, if she seems like a different person, say something.
Say, what's wrong? How can I help?
And ask straight out. Are you thinking about killing yourself? It doesn't hurt to ask. In fact, it helps.
When people are thinking about killing themselves, they want somebody to ask. They want somebody to care.
Maybe you're afraid you'll make it worse if you ask. Like, you'll put the idea in their head.
Believe me, it doesn't work that way.
It doesn't hurt to ask. In fact, the best way to keep a teenager from killing herself is to ask, are you thinking about killing yourself?
And what if they say yes?
Or maybe.
Or sometimes,
Well, here's what you don't say.
that's crazy.
Don't be such a drama queen.
You're making too much of this.
That boy's not worth killing yourself over. That's not going to solve anything.
You're just trying to get attention.
You're not going to kill yourself. What you do say is,
I'm sorry you're feeling so bad. How can I help? We'll get through this together.
Let's keep you safe.
a lot of people think about killing themselves. Adults and kids. Most of them never try it, but some of them do. So if your kid says,
I'd be better off dead. I can't live with
I'm
this.
gonna kill myself, take her seriously. Find someone she can talk to about it. Someone who knows how to help.
Sometimes kids want to kill themselves because something happened. A breakup, a failure. But sometimes it goes deeper, and it's not going to go away by itself. Get some help. Talk to your doctor.
Or a counselor at school.
Or your minister.
But don't just let it drop.
And make sure that your kid always has someone to turn to. Someone he trusts. Make a list together, right then. 3, 4, 5 names.
Put a suicide hotline number on there too.
Have him keep that list in his wallet, so he always knows where to turn.
Make sure your home is safe. If you have pills she could use to hurt herself, lock them up.
If you have a gun, don't just lock it up. Get it out of the house. The bullets, too.
And one more thing. If you think your kid might be about to hurt himself, don't leave him alone.
Take him to the emergency room.
Call 911 if you have to.
We all have our ups and downs, but sometimes it's more than that.
If you think something's wrong, the only way to find out is to ask. Ask straight out. Are you thinking about killing yourself?
Don't wait until you're sure. Trust your gut, because it never hurts to ask.
And it can make a big difference. All the difference. In your kid's life.
Okay, so that was a really heavy video, and thank you all for watching that. And right now, we want to take a few minutes just to debrief the video. So we are going to ask you to share out, but I do want to know if you are in a space right now where you are not comfortable sharing, that is okay. Please continue to remember the community agreements and exercise that self-care and take that break if you need to. But if you are open to sharing, we are going to share out about your thoughts about the video that you just watched. So if you are with us virtually, go ahead and put your responses in the chat. Is there anyone here with us in person today that feels comfortable sharing? Kathy, do we have any responses in the chat?
Yes. I appreciate the reminder of what to say next after the person shares they are thinking about suicide.
Very good. Okay. Thank you. And so now we're going to take our first break. Before we go ahead and do that, I do want to remind you all of our parking lot over there. If any questions are coming up, please write them down on the sticky note and put them on the parking lot for us to address them. We will go ahead and start our break now, 5 minutes. So we will go ahead and return at 9:52. Okay, enjoy your break. Okay, so we are gonna come on back from our break. I do apologize about that timer. Yeah. And just, I think it caught everyone off guard. Yeah. Okay, so during our break, we actually got some more great feedback and responses in the chat. So I do want to pass it to Kathy to share out some of the feedback from our virtual attendees in response to the teen suicide prevention video.
So asking about suicide does not put the thought in their heads. And this is a valid statement. I think there's a misconception of, asking um, this misconception of, oh, if you ask these questions, they'll put ideas or thoughts into the mind when that is not the case. So thank you for bringing light to that. Also, I could feel the difference in the two adult responses. One felt invalidating and shaming, and the other felt so much more hopeful. I appreciate the variety of people listed as trusted adults someone can talk to. Yeah, having that like safety plan of, lines that they can access is really important. Um, it is true, people might be scared to ask, thinking it will put the idea in their head. This was a good reminder. Um, we really need to do, we really do need to have more direct conversations about this. And as someone said above, it is very useful to give adults and kids language to use when they hear someone else express the desire to harm or kill themselves. And lastly, something I remind myself is that suicide is a problem-solving tool, granted a maladaptive one. However, helping to look at the intersectionality of the problem is really important, and the treatment process, post-reporting. It is imperative to continue to help the student problem solve in adaptive ways. This is why SEL is also valuable in schools. It does not prevent all suicidality, but it can help provide more options for students to cope and problem solve.
Thank you. Very insightful. Thank you, chat, and thank you to everyone for participating. So, full disclosure, these next couple of slides are going to be a little pointed. We did design this PowerPoint, this presentation for new teachers and teachers. And a question that I get a lot is, I'm not a counselor, so why should I care? I'm not saying anybody in here is saying that, because you're here because you want either a reminder or you're looking for some information. But this is a good tool for how we can talk to our teachers who may be a little resistant to this work. So we just need to let them know that you play an important role in suicide prevention and identification. A gatekeeper, by our definition in this suicide prevention training, is anyone who works with children or teenagers. So just know you play two important roles in preventing suicide. First, as a gatekeeper, you may recognize that a youth is having difficulty and may be at risk for hurting themselves. We are in the classrooms with our students a lot for half the year. We are in the classrooms with our students more so than some parents. That's not pointed, but that's just the reality. So we may be able to identify signs and symptoms before other people, their friends, so because we know our students. Second, as a helper, you may take action by connecting with the student and assisting the student to access help. So you may be that person in the room who's providing that warm handoff to get a student to the school psychologist or the school social worker that can provide the necessary tools that they need. So why all school personnel have an important role in suicide prevention? So we know that identification of students who are seriously at risk of self-harm is the first step of the intervention process. Again, like I said, identification of students. So when we recognize those warning signs, that is the first step of us intervening into the students to get them some help. Students view school personnel, teachers, staff, and administration with trust. You may not know this. Your student who's giving you a lot of issues, who gives you a headache every day, you may be the most trusted adult in their life, okay? So it's very important for all school staff to receive suicide prevention training, because if it's not the teacher, it could be the custodian, it could be the person working in the front office. So we need to let everyone know these tools and skills so that they're able to get the student the help that they need. Teachers and staff get to know students over an extended period of time. Like I said, we're with them a lot. Some of us are with them more than we like. I know that during that March, April time is why I was looking, when is summer coming? When is summer coming? When is summer coming? But just know that we are with these kids a lot of the day. And schools often include coping skills, problem solving, and stress management as part of socially emotional curriculum to address mental health issues. So that's why it's so important for us to have these SEL Wednesdays. I don't know if all schools have SEL Wednesdays, and it's also very important to incorporate socially emotional learning into the curriculum as much as possible. So when we talk about what is a trusted adult, I'm going to pose this out to the audience. When you go to someone, your partner, your friend, your online community, because we all know that we can find community anywhere now, what is something that you hope they have? Why do you go to them? You can just shout it out. You don't have to speak. Reassurance, yes. No judgment, excellent. Validation, yes. Did I hear two validations at the same time? Whoa, best friends. Anything else? Acceptance, yes. Thank you. And then in the chat, go ahead. Empathy, I see. They listen, yes. SEL Wednesday. So I know at certain schools that we work with, I know at my school, Golden Gate, that I used to work at, we had Wednesdays that were specifically for socially emotional learning. Like I said, I don't know if they're at every school, but so for example, the first class and the last class was dedicated to teaching coping skills, mindfulness skills. It's really, we had a curriculum dedicated to helping students just work on their mental health. So if that is something that you need help navigating, please reach out to a WISP liaison. I will give our contact information towards the end, and we can help you navigate that process and point you to some curriculum. There's a lot of good stuff out there. Thank you for the question. So like you all said, thank you for all the responses. What comes to mind when you think of a trusted adult? Kids say it's a good listener. They offer advice. They show empathy, or they won't make you feel silly for coming to them. The most important thing we can do when a student comes to us for help or lets us know that they have something going on in their lives, please remove yourself from the computer in front of you. Please allow yourself to be fully present for that student. Because a lot of times when we go to someone and they're on their phone or they have something else to do, you feel silly for, why did I waste my time? I could have just kept it inside. So please make sure that we're giving the students the full attention. Someone that they feel a connection with. So that's really, really important that we build just cultures of community at our schools and in our classrooms, because we really want our students to feel connected with our adults on campus. And then a trusted adult is reliable and dependable. I'm going to state this because we all know working with students, the thing that will get you to lose their trust is if you say something and you don't follow up. So if you're going to say something, it's imperative that you follow up with what you say, okay? Our kids can smell BS more than anyone. I almost cussed, sorry. Can smell BS more than anyone that we can work with, especially our middle schoolers and our elementary school kids. So what is the role of the trusted adult? Is to listen and to validate how hard it must be to confide in someone or to ask for help. So it's really important that we listen to them. We don't try to fix their problems right away, and we validate them. Thank you so much for coming to me. I really appreciate it. I know it was hard for you to come to me. I hear you, and I want to thank you for it. And then help the young person get to the appropriate person to provide the help or support they need. If you do not have the credential to help diagnose these students, please don't be diagnosing these students. If a student comes and talks to you, please don't set them on a couch and start playing Frasier with them, okay? We really want the people on staff who have the credentials and the experience to be diagnosing the students. Your role there is to listen, validate, and do the warm handoff. So what if you are a trusted adult? Stay calm and listen. It's a lot of times we don't want to exasperate their feelings, so we don't want to get too excited. I'm very guilty of this. When my students would come to me, I would also get really excited. I'd get into the ring with them. It's really important for us to stay calm, okay? Thank them for trusting you. It took a lot of courage for them to come and talk to you. When I went to Miss Landis, it took me about a month to work up that courage to tell her that something was going on. And the first thing she did was thank me and give me a hug. That made me feel seen and that made me feel loved, okay? And be sure to take care of yourself. I think a lot of times we go day to day without taking care of ourselves. We're carrying a lot of secondary trauma and we don't even know about it. So if you have a tough day, if a student is coming to you and saying some really heavy things, it's really important for you to utilize your self-care strategies to take care of yourself. And then we can go a long way toward helping a young person simply by acknowledging what they say and treating them with respect and sensitivity. That's all we have to do is just treat our young people with respect and sensitivity, take the time to listen to them, and again, validate and make them feel heard and seen. So these are just some quick tips on being a trusted adult. I believe this is also in your packet. We're not going to go through this because we have a time crunch a little bit, but just know that be prepared for the truth is something I really wanted to highlight. We know that our students will tell us exactly what they're feeling, and it's important for us to be patient, not get aggravated, not get angry with them, and not try to correct what they say. A lot of times, I know I'm 35, I don't have the tools myself to tell my partner when something's going on. I have to take a few days to kind of collect my thoughts. And this is the same for our students. They just don't have the training like some of us in the room, and they don't have the experience like some of us in the room to be able to articulate what's really going on. So just be prepared for the truth and always validate their feelings, and then listen to your gut. This is your best tool. If something doesn't feel right, it's not right. We're all mandated reporters in this room, so it's really important for us to follow our school protocols. And then remember your training. I believe Cynthia said is really important for us to know our school protocols and follow those school protocols because every school is different.
Okay, and then I'm going to talk to you all about check-ins and the importance of listening. So, the most important thing that any adult in a school can do is connect with the students and keep all lines of communication open. And this also involves paying attention to indirect communication as well. And many times a student may not necessarily directly state that they want to kill themselves, but they typically will show some sign of being troubled or at risk. And the key component of communication is to listen. So many times adults will report that they don't know what to say. But the reality is that a student who is in emotional distress just needs someone to listen to them. And it's okay to listen and be honest when you don't know what to say. And this brings us to empathetic listening. So, when you're having these conversations with the students, you really want to try your best to do the following here: use reflective language, validate and normalize, stay present, be non judgmental, use minimal encouragers, and express care and concern. And our language matters. So the words that you use with your students are so important. And so we have created some helpful tips here for you to utilize when speaking with your students. And in the folders that you have, this slide is in there. It's also in the electronic materials that were sent out. So please feel free to follow along. But we have allow youth to express their thoughts uninterrupted. Refrain from providing unwanted advice and feedback. So, really creating that safe space for the youth to express themselves freely, allowing them to feel seen, heard, and validated. We want to be intentional. You don't have to listen to respond. So, what am I talking about here? It's really about being an active listener, being fully present and engaged to the conversation, and focusing on the words that the student is saying rather than how you might respond. And of course, in the conversation, when it's appropriate to respond, you want to be thoughtful, honest, and respectful in doing so. Next, you want to understand your boundaries and your limitations within your role. So, I know Edmund mentioned earlier that for our teachers and school staff, the focus is not to diagnose them, but the focus is to be that trusted adult, to have those important conversations, and to help get them connected to the appropriate resources and supports. And you all are the experts with your schools. So maybe that's to your school social worker or your school psychologist or whomever that designated mental health support person is at your site. And this is the biggest one and most important. Do not leave your youth alone or unattended. So let's say, for example, you are supporting a student in your classroom and this conversation is coming up. What you can do is engage in a warm send off. So, this might look like physically walking the student or escorting them to where those mental health supports are. And it's going to look different at every school site. But let's say, for example, maybe it's the wellness center, physically walking them from your classroom to the wellness center so that they feel supported. And I do want to just emphasize that, again, your language matters and we do have more power than we realize.
So what do we do? What are the intervention steps? So when a teacher or a mental health professional, what do we do when a student comes to us and they tell us about their mental health challenges or they let us know that they just don't want to be here anymore? So we're going to break out really quickly and we're going to have this question. Meet with the people at your table and have a conversation. So how does your school and district identify students who may be dealing with a mental health crisis or at risk of suicide? And the second question we want you to talk about are what steps does your school or district take when a student is identified as being a risk? We're going to give about 5 minutes for this question. And yeah, just go ahead and talk about what your school or district is doing. And if you're in the community, let us know what community supports you can provide as well. We love the engagement, but we're going to give you another minute to wrap up your thoughts. We have about 30 seconds, then we're going to reconnect. Welcome back, virtual attendees. Thank you for sharing. Hope you made some connections. We don't have the opportunity to share out right now, unfortunately. I'm sorry. Doing multiple things. No, you're good. Okay. So I hope you were able to share about some things that you're doing. We're going to share some tools with you right now. So in your folder, on the one of the sides, I don't know which side, we have printed out a list of tools from our CCOE policy. We also printed out some tools from the Antioch Unified School District Suicide Prevention Policy, which we believe is very strong. So if you want to connect with us during the break, during or after the training, just to ask us some more questions about what you have in your packet, just let us know. But we just want to go over some general steps for responding to any reports of a student at risk of suicide. So this is again from the Antioch Unified School District. They developed the suicide prevention protocol last year. So just know that we need to respond immediately. You need to report any concerns to the counselor, administrator, or site safety as soon as possible. Please do not wait on this. You need to make direct contact. Do not leave a note, do not email or voicemail, and do not wait until the end of the day or the next day to make contact. This contact needs to be made as soon as possible. You need to make sure that you ensure that a student sent to the office for assessment is accompanied by an adult and not a student. And I just want to make note, this is Antioch School District policies. If you have a wellness center or if you have any type of office for the mental health counselor or school social worker, it's more appropriate to send them there, because I know that if I would have went to Miss Landers or one of my teachers and told them of that I was having an issue and I got sent to Mr. Jerry Guido's office, who was in the main office, I would have been triggered, okay? Because that's giving me the connotation that I'm in trouble. So if there's a more appropriate place for us to send our students, it's really important for us to do that. Do not leave the student unsupervised, okay? This is the most important thing. That's why we highlight it. Do not leave the student unsupervised. Do not make them think that they're alone. Do not make them think that you're not there for them, okay? So it's very important that you stay with the student until the appropriate help comes. And then document what the student said or did what that was of concern. And if you saw, if there was any indication in like an art project or a journal entry or a creative essay project, make sure that you include copies of any concerning writings or drawings in that report. I do want to make note that we have the Contra Costa Office of Education has developed a suicide prevention protocol and policy. It's on our website, and we were going to send you a link to it in our follow-up email. But just know that this is a comprehensive suicide prevention and intervention policy and protocol. These prevention and intervention guidelines are designed to have procedures in place to prevent suicide, assist students who are at risk of suicide, and intervene and respond appropriately in a suicide-related crisis. This serves as a resource for other districts and agencies in their suicide prevention and intervention efforts. Please utilize this resource as a guide for creating your own suicide prevention protocol. If you don't have a suicide prevention protocol in your district or your school, it's really important that you advocate for one, because it is the law. Again, reach out to the WISP liaison and we can help assist you. We can find you any writings that you need or any reports that you need to help enhance their effort as you advocate for a suicide prevention protocol in your district or school. So we're going to break out really fast again. So we want to know, what is your school district's official policy on suicide prevention? Does your school staff know about it? And is it readily accessible for everyone at your school district? And can you share anything that you're proud of or anything that your school or district needs to work on in terms of your suicide policy? This is going to be a quick breakout. We're going to have about 2 to 3 minutes for this one. We're going to wrap up in about a minute. I know this is an important question and we didn't give you that much time to connect.
Okay, so just like Edmund was saying, thank you all so much for taking the time to connect and to discuss those questions, and we really appreciate your participation. So now we're going to go ahead and move into the next portion where we're going to talk about the conversation. So we're going to play a video for you all, and we're going to look at why it is so important to ask about suicide.
People don't decide they want to die or die by suicide because you mention it to them. It doesn't put the thought in their head. It's actually the opposite. You can help save the person by asking them about suicide. So asking the question is something that one wants to do. If in any way you think the person is suicidal, if someone's telling you, I'm really upset, and the first thing is to say, I'm sorry you feel that way. We can have you see someone and you can get help. Other signs of suicidal behaviors, they're starting to plan to give away their items and don't see a future for themselves. You might ask, have you thought of killing yourself? I don't like the vague thing, have you thought of hurting yourself? Because I don't know what that means. It's much clearer if you thought of killing yourself or suicide. That's a specific question, and they can say, no, I would never do that. And if they say that, they probably mean that. People about suicide are very honest if you ask them. Because people who are suicidal are ambivalent, meaning they don't want to live, but they don't want to die either. They don't know what they want at the moment. And what they want is someone to step in and do something. By asking them, you are now stepping in, and they can feel a sense of relief that I got it off my chest, that I want to die, and move them to the next step in this is, let's get help. If they are in therapy, the question would be, why don't we call your therapist and see what they have to say. If they're not in therapy, the options are, there's always the emergency departments. The police can take you if that's urgent and needed. In Delaware, there would be crisis services can come out to assist there. But for the non-professional, the answer is get them to a professional. You should not be trying to assess them, or you should not be taking the risk and responsibility that they're not going to kill themselves in the future. But you should not leave them alone either until you can get them assessed. It doesn't stop because you've asked, it begins. And now if they get help, suicide is a treatable problem. People can deal with it and not be suicidal again in their life and lead a productive life in whatever way they want that to be.
Okay, so for that video, we are going to do a share out, but really quickly, I do want to point out they did mention Delaware, but we will be doing a whole resource section later on in our PowerPoint presentation where we will highlight Contra Costa County specific resources. And I do all want to focus your attention inside of your folders, and it was sent out virtually. There is a QR code resource page that has direct links to all of the resources that we will be sharing with you all today. And so let's share out. So if you're with us virtually, go ahead and put your feedback in the chat box here. And then we want to discuss this question. Watching this video, how do you feel about having this conversation with your students? Is there anyone here with us today in person that would like to share? No? Okay. Kathy, do we have anyone that is putting in responses in the chat?
I think it's really powerful hearing those words. Are you thinking of suicide, killing yourself? I myself have been afraid to ask those questions, so this is eye-opening for me.
I also appreciate the vulnerability there. Anything else?
I think for me, it's a struggle to have that huge sense of responsibility being a counselor and like I have to be the one to initiate a 5585 or to complete a risk assessment and having that verbiage of like, hey, have you thought about killing yourself today at any time or any point in time? It's always a difficult way, natural way to want to be able to ask it sensitively rather than just upfront at times. And so that's a challenge for me that as I'm learning and in the profession of like how to say it in a way that's comfortable for myself and what's the word, real for me to be able to say it or and support them in that moment.
I appreciate that.
I'm curious about it being curable. There are so many high-profile examples of people who have access to all the resources, and if they couldn't overcome it, what does that mean? There's also another question. I've been told that the "I'm sorry you feel that way" statement is more harmful than hurtful. Rather than repeat back what you heard and state that, it sounds difficult. Can anyone comment on that?
Can you repeat the question? I'm sorry. Sorry about this. Yeah, I think the main concern is just, like we said, just validating the student. We're not there to diagnose. I think echoing it back to the student is kind of repeating it in their heads, is what I've heard. So the main thing for us is just to validate what they're saying, thank them for coming to us, and then getting them to the appropriate help. Let me do some more research on that question. I don't have an appropriate answer for you right now. And we do please ask you to utilize the question and answer feature in the chat so that we can save all your questions. And then in our response, on our follow-up email, we will have a list of all the questions and we will have appropriate answers for all of those. Sorry about that. So I'm sorry, we do have to move on because we are on a time crunch right now. So these are just some 10 steps from the JED Foundation. It's a mental health awareness program that we're really want to highlight. So we they give you 10 steps on how to just talk to someone, how to handle someone when they come to you and talk to you about suicide. So it's really important that you pick a place and time to maximize privacy. So that's like we said, it's important for us to have wellness centers. It's important for us to have places on our schools or on our campuses that students feel comfortable and safe to speak to you about certain things. And it's really important for us to start by expressing your concern and your desire to help. You always need to tell the student that I'm concerned for your safety and that there is help for you. We do want to provide help for you. Ask them directly if they thought about suicide. So that's what the video that we just watched pointed to. Keep the door open if they won't talk to you. So what we mean by keep the door open if they won't talk to you, your student may not feel comfortable talking to you about the issue. There might be someone else on campus that they feel more comfortable talking to. So just being open to bring that other person into the conversation to have that conversation. So that was repetitive, sorry. Stay calm if they say yes. Again, we don't want to exasperate their feelings. We just want to make sure that we stay calm and we're in it with them. We need to listen and validate their struggle. So again, we're not trying to echo what they're saying. We're just listening. We're not trying to fix their problems. We're not trying to diagnose them or anything like that. We're sitting there, we're listening, and we're validating. I hear it's really hard for you. I understand that. Tell them you want to connect them to help. It's very important that you say that there is help out there. There are tools and strategies that you can utilize to help with these feelings, and that there is help either on campus, and if there is some resources on outside of campus that you can connect them to, that's also helpful. Don't promise to keep what they tell you a secret. It's really important that we let them know that we really care about them. And it's important for us to let them know that if we keep this between us, it might be harmful for them. So it's important for us to say, I care about you so much. I cannot keep this a secret. I do need to bring someone else into this conversation so that we can have so we can start looking for tools and strategies to help you at this time. Get immediate help if they're unsafe. So if they're immediate concern to anyone on campus or themselves, it's really important for us to get in contact with someone, with either 911, 988. We will have resources towards the end of the presentation today. And then again, remember to take care of yourself. Anytime a student comes to you and tells you that they're having a mental health challenge or they feel like killing themselves, that is some secondary trauma that you're taking on. So please be sure to take care of yourself.
Okay, thank you for walking us through those 10 steps, Edmund. And now we're going to dive in a little bit deeper into that conversation. So, starting off, we have listen, validate, and acknowledge. So, an example of something you can say is, I hear you saying you just can't take it anymore. Then we move to the second portion here. And this is very challenging and uncomfortable, but it is an opportunity to lean into that discomfort and really show up for the student that needs you. You want to ask about suicide and your concerns directly. So, what does this look like? Are you thinking about killing yourself? And finally, you want to express your concern. It sounds like you're in a lot of pain. You do not have to be a mental health expert. We can all save a life. And so, let's say you're having this conversation with your youth. You can use that reflective language and say, you mentioned this, this, and this. Are you having thoughts of suicide? And with that, you want to express care. I'm here for you. Then we move into the reach out phase. Let's find help for you. This is where that warm send off comes into play. Connect them to the appropriate resources at your school site. Again, your school social worker, school psychologist, mental health professional. And then finally, you want to follow up. So you want to keep that line of communication with your students open. It does not end once you've connected them to the appropriate supports. You want to continue to follow up and check in with them. And so now we're going to move into a breakout where we're going to discuss a case study. And so for this case study, you'll be utilizing the breakout rooms or connecting with your groups here in person. So you notice that a student in your class is visibly upset. They disclose that a close friend has just died by suicide and they are overwhelmed with feelings of grief and helplessness. They want to be home with their family and their friend's family, but they also have upcoming projects due in many of their classes. They express feelings of hopelessness and say, I don't think I can cope with this. I think it would be easier to just end it. So in the next 7 minutes, we are going to ask you to connect with your groups here or in those breakout sessions and discuss what you might say to these students. And we want you to utilize this time to practice these questions here. So, for example, student's name, are you thinking of suicide? Student's name, are you thinking of killing yourself? And now I do want to point out, I know that we have some experts in the room. So if you are an expert and you do not need more practice with these particular questions, I encourage you to use this time to discuss and think about how you may approach this conversation with teachers or other school staff or site personnel back at your campus. How may you approach that conversation? So we'll go ahead and start our 7 minutes right now. Okay, 2 more minutes, and then we're gonna go ahead and regroup. Okay, we are gonna go ahead and regroup. Okay, so we are now going to move into a share out and let's talk about how that activity made you feel. So, for those of us, or for those of you who are participating with us virtually, go ahead and put your feedback in the chat for us. Is there anyone here that's willing to share out in response to these questions? So, how do you feel about having the conversation now? Did practicing the conversation help? And how would you coach teachers or support school staff in ways that will help them approach this conversation with students? Is there anyone in the audience that's willing to share out? Okay. Kathy, do we have anyone in the chat box?
It made me feel nervous. I wanted to make sure that I said the right thing.
I think for that second question is like, how do you coach teachers and support staff? In my experience, I think you start off by saying it's okay that you're not the expert and you're not causing harm and you're not going to be held liable for it. And I always remind them of the Good Samaritan law. It's like, so you're trying to help, and that kind of eases them like, okay, I'm not going to lose my job. It's not my job. I don't know what to say. Well, just be a good listener.
Thank you. Okay, so we're going to go ahead and move on. Thank you all for participating in that. I know that it was challenging. Oh, it looks like we have one more.
In the back corner here, hard to see.
No, I just wanted to add to what had already been shared, that the way for our teachers to also get comfortable doing this is also to train them. That we need to continue to bring suicide prevention, mental health education, training to schools. Thank you.
Yeah, thank you for that. The training is very, very important. But thank you again for your engagement and your participation to this activity. That practice is really important.
So we do have just example of things to say to a struggling student. So what do you need right now? How can I support you in this moment? What can I do to help? And then again, like we sound like broken records, but anytime a situation is outside your scope of practice, you need to do a warm handoff to a school professional that can help assist. And then just an example, thank you for sharing your information with me. So again, you're thanking them. Your safety is important to me. You're letting them know that their safety, they are important to you as a person. I think it may be helpful to identify additional ways to support you. Perhaps we can invite someone else into this conversation. I think that's really important that you're saying we invite someone else to this conversation. You're not kicking them out the door. You're not putting it on them. You're inviting someone else to be a part of the conversation that you just shared. I'm not going anywhere. I'm here with you on it. So these are just some things to be careful of when you're having this conversation. Mary, on this board or on this slide, what are some things that you just can't stand when you go to people?
Yeah, so what's coming up for me here is avoidance and subject changing. And to me, those two concepts are related. And I think it's important that we acknowledge just how much courage, strength, and vulnerability it takes for a student to come and ask for help in the first place. And so if I was that struggling student and the person that I chose to confide in was avoiding me and changing the subject because it was so uncomfortable and challenging to talk about, as a student, that would feel really sad and lonely and just invalidating. And so, if I was that struggling student and I worked up the courage to come to you for support, I would want that space to be able to express myself freely. I would want to know that that adult is going to show up for me, especially in my time of need when I need the most. And I need that space to feel seen, heard, and validated.
And for me, it's just don't bright side me. I think a lot of times when people come to us, we'll say it'll be better the next day, sleep on it. Next week, you'll feel a lot better. I sometimes can't see next week. I'm just in the moment. I'm just in a negative spiral right now, and I just need you to be in it with me, validate me, and thank me for coming to you. Because, like I said, it takes a lot of courage to tell someone that something's going on. So we're going to have another break here, 5 minutes, and then we're going to go into our final portion of our presentation, and then we're going to transition over to our special guest. Thank you. We're gonna very tight time crunch. Sorry for the alarm. I know it's triggering. I didn't realize that it was like that loud. I apologize for it. Just let us know in the evaluation that you hated the alarm. We need to find something more soothing to bring everyone back. So I just want to highlight postvention. We're not going to go too deep into it because every school is different. But again, I really want to highlight the CCOE Suicide Prevention Protocol. Again, we are going to send it to you, but it does give a detailed suggested component so you can add it to your own suicide prevention protocol. It's step by step. It was made by the CCOE Mental Health Services team. We did not create it. It was by our school's counselors and our school's social workers who work at the schools like Marcus, Golden Gate, and Mount McKinley, our juvenile detention center. So those are we really want to highlight that. It's a really good step by step. We can't really go into that right now, but just again, we will send this all to you at the end of this presentation. We do want to talk to you about, we do want to show you this video because we do think it's really important that we know how to talk about suicide when there is a death by suicide on campus.
When we talk about suicide, it's important to use the right words. For example, most people use the term committed suicide without realizing the word committed has criminal connotations. People commit crimes like homicide and assault. To place suicide in the same category is inaccurate because suicide is not a criminal act. Another one we often hear is completed suicide, but this is also problematic, because the word complete is commonly associated with the idea of a task that has been finished, which, in the case of suicide, is death. Two other common suicide terms are successful attempt and failed attempt. The problem with these terms is similar to the problem with the term completed suicide. They associate suicide with success and failure. They attach a misleading idea of achievement to suicide, where success means death and failure means life. Instead, we encourage you to use terms like non-fatal suicide attempt or just suicide attempt, and phrases like died by suicide or death by suicide. These are factual and free of connotations. They do not imply suicide is criminal or that suicide can be either successful or failed. The last thing most of us would want to do is unfairly judge a friend or loved one for feeling sadness or for contemplating suicide. It is common that people feel nervous to say the wrong thing to a friend or loved one who is hurting. We want to be careful, and so we use terms and phrases that we hear others say. But when people are deeply hurting, they need openness and compassion. And this is why it is important to think about the ways we talk about suicide and to encourage others to use language that is thoughtful and intentional.
So we want to show that video. We were going to have a share out, but we had to get rid of it. So just in the chat, if you want to put what you felt about the video. And this is not to make anyone feel bad, because I think I used complete suicide 3 times this week. The language is always changing. So it's just for us to be mindful of how we're talking about it with our students, how we're talking about with our family and friends. And again, it's like everything we do with practice, it'll get easier. So we just wanted to touch on the fact that it's important for us to be mindful of how we talk about suicide, because the suicide contagion, it is a rare phenomenon that young people see more vulnerable than older individuals. But just know that suicide contagion refers to the process whereby one suicide or suicidal act within a school, community, or geographic area increases the likelihood that others will attempt or die by suicide. So the reason why we are talking about it's important for us to have the right language around suicide is because a factor that contributes to suicide contagion is the glamorizing or romanticizing of suicide that can occur in the process of communication of suicide death. Care really needs to be taken not to give students the impression that suicide was a positive outcome, and contagion is more likely when observers identify with the deceased. We do want to highlight this really quickly, and the reason why we want to highlight this really quickly is if there is a suicide death on your campus, it's important for us to identify these students in our care teams or any other teams that we have on campus so that we'll be able to get the students the supports that they need. So we know that geographical proximity, so any young people that have witnessed the death were exposed to it or had contact with the person shortly before they died. Psychological proximity are people who relate to deceased through cultural connections, shared experiences, or perceive themselves to be like the deceased in some way. So if you're bullied by the same person, our LGBTQ young people, if one person, I must state it again, has a death by suicide, then we know that it's very important for us to identify these other students so that we can get them support. And then social proximity, people who have had a personal relationship or if they had a perception of closeness with the deceased. So this means that they had the same homeroom together, they rode the same bus together. They may not be best friends, but they know of each other and they're aware of each other.
And then we're going to talk about protective factors. So, protective factors, we have individual protective factors, relationship protective factors, community protective factors, as well as societal protective factors. So, at the individual level, this might look like effective coping and problem solving skills. It may be reasons for living, so families, friends, and just a strong sense of cultural identity. And then for our relationship protective factors, the support from partners, friends, families, and just, feeling connected to others. And then moving along into community protective factors. So, feeling connected to your school community, to social institutions, and just the availability of consistent, high quality physical and behavioral health care. And then our last one is societal protective factors, right? So, reduce access to lethal means of suicide among people at risk, and cultural, religious, and moral obligations to suicide. And so protective factors, they embody many factors that can actually reduce the risk of suicide. And so it's very similar to risk factors in the sense that there's a range of factors, like I mentioned, at individual, relationship, community, and societal levels that can protect people from suicide. And it's very important to note that everyone can help prevent suicide. We can take action in our communities and as a society to support people and help protect them from suicidal thoughts and behaviors. And so, one of the biggest ways that we can do this is by building resiliency for our students. So, what does this look like? So, first off, maybe it's trauma informed schools, championing mental health, supportive adults, mental health clubs. I do want to just point out here that the photos that you're looking at are provided to us by Bring Change to Mind, which is a partnership that we're working with to expand wellness clubs on our school campuses. We also have wellness centers. And then for other schools, we also have calming corners. And so I really just quickly want to highlight those wellness clubs that I just mentioned in the previous slide. You will notice in your folders and the electronic materials that we sent out, there was this flyer here about school wellness clubs. So if you're interested in bringing a wellness club to your school site or campus, we highly encourage you to attend our informational session that the Wellness in Schools program is hosting tomorrow morning, Wednesday, January 31st at 8:30 a.m. It is virtual through Zoom. And if you're interested in attending, you can go ahead and scan the QR code here. And it's also on the flyer as well. And then if you cannot attend but still want to receive the info, email us, talk to a WISP liaison. We'll get that information for you. But this is one way that you can build resiliency at your schools and help improve the mental wellness of our youth. And so we do also have a supportive network that you'll get more information about soon, but it's a club advisor collaborative, and that's that supportive network to share best practices, ideas, and ensure our wellness clubs are running effectively and efficiently. And so this brings us back to our gingerbread person. This is part 2 of our activity. So because we are on a time crunch, we are only going to allow 3 minutes here, but we are going to ask you to connect with those same groups you had earlier and look at these questions here. What supports can you provide to help students who are dealing with a mental health challenge? Write supports that your school or district can provide outside of the gingerbread person. Think about the resources, so counseling, maybe referrals to mental health services. Think about what those resources are that your school or district can provide for students suffering with a mental health challenge. So let's go ahead and take those 3 minutes now to write the supports outside of your gingerbread person. Just one more minute, and then we're gonna go ahead and regroup. Okay, we are gonna come on back and regroup. Thank you all so much for your participation and connecting with others in the room. What we are going to do is we're going to ask you to leave those posters out, and the WISP liaisons will collect all of that information and be sure to share that out when we share out our follow-up email and the slide deck as well.
So we thank you. We are going to get to our special guest today. We do ask that you complete our evaluation. The more evaluations that we get, it just helps us better cultivate these trainings for you. So please be honest. Give us your honest feedback. And if you want us to come to your campus and provide this for your school sites or anything like that, please let us know. We can also alter it for parents. We can do a parent training for you. We can also, I think we're in the process of developing something for students as well. So just let us know what you think about it. We're going to give you some time to complete the evaluation while we gear up for our presenter to take over. And yeah, I am going to actually go over some resources also really quickly. So I hope that you can complete this evaluation. The more, like I said, the more evaluations that we get, the better. And we also need to show our funders that we're doing trainings, and I want to keep my job, so I'm not above begging. My staff is shaking their heads right now, but. So I hope everyone was able to access that. We will also send a follow-up link if you can't do it through your phone. And then we'll send that in the follow-up email. That'll be the first thing that you see. I do also want to highlight the Wellness in Schools program resources. We have a link here. You have a QR code with the resources that we're going to go over, but we do our resource page that has bullying prevention, foster and unhoused resources, suicide and crisis intervention resources, and our virtual wellness center, which has a link of various activities like for mindfulness. We have coloring activities for students. We have all kinds of activities that you can incorporate in your wellness center or in your wellness corner or in your classroom. So we really, and then in addition to that, we have a page just for resources. So we really want you to utilize those resources and then give us feedback. If there's some things that you've come across that aren't on the resource page, please let me know so I can add it. And if there's some things that you think just aren't relatable, why is this on here? I'm pretty good at taking critiques also, sometimes. Ignore that slide. We do have our WISP liaisons in the room. We have, if they want to raise their hand and you can reach out. We do want to ask you if you want to be connected with a WISP liaison to contact us. Our contact information is also on the website. Unfortunately, we don't have time for them to introduce themselves, but they are wonderful people. We're located all across Contra Costa County. So if you're unfamiliar with who can help serve you, just let us know and then we can connect you to the right appropriate person. And I believe someone just put the contact information for the chat for all of our virtual attendees. We also want to highlight the 988 Suicide and Crisis Lifeline. Just know that 988 is the new suicide crisis lifeline in Contra Costa County. 988 offers access 24 hours a day, 7 days a week. People can call or text 988 or visit 988lifeline.org for themselves, or if they are concerned about a loved one who may need crisis support. Just a note, I've tried to call 988 when the student or the person wasn't with me. You need to have the person with you when you're calling 988 because they want to provide direct services and they want to talk to that person directly. We also have our wonderful partner, the Contra Costa Crisis Center. I always get hung up when I say that. It's a tongue twister. But for help with any mental health crisis, you can call 211. And there's also community and family support, not just mental health supports. There's also, if you need food assistance, if you need any other type of assistance, they can help provide you to that. You can also text HOPE to 20121, which is it's also available in Spanish by sending the same text. Just know Contra Costa Crisis provides local health and social services 24/7. Counselors are trained to provide crisis counseling and post-vention support. I do want to highlight something that Contra Costa Crisis Center can do that I was not aware of until recently. There was a death by suicide in one of my schools in West Contra Costa County. I was able to link that school with Contra Costa Crisis Center. They actually came out and they provided some grief counselors and they provided a safe space for students to be able to process the event. So if that's something that you need, any additional resources, again, reach out to your WISP liaison and we can help you do the legwork in that effort. And also I want to note that they have a suicide prevention training that's free. It is on February 20th. It's more for the community, adults, parents, anyone who's just wanting to learn more, practice these skills more, or get more information. I want to highlight the Trevor Project. The Trevor Project staffs train counselors who understand the challenges of LGBTQ young people face and are available to support 24/7. If an LGBTQ young person does come to you, you can text START to 678-678 or call 1-866-488-7386. Our WISP liaison in the back, Allie Cannon, can also provide Trevor Project's ally and care trainings for your school. So if that's something that if you want a more focused suicide prevention or an ally training for your school, please contact WISP. We'll connect you with Allie Cannon and we'll be able to come to your school, provide those trainings. I also want to highlight an upcoming TUPE event. TUPE will be hosting a virtual event on March 7th on fentanyl awareness and overdose rescue training. Our special guest will be presenting at that. We're keeping her very busy. So please, you can join CCOE's Tobacco Use Prevention Education Program to hear from a panel of local experts, including young people and parents. And the topics that will be covered are fentanyl and why it's so dangerous, how to respond to suspected overdose, and where to access Narcan overdose kits, which is also going to be our next portion of this training that we're going to start now. So I would like to introduce Mariela Sunding. I believe I said that name right. You can slap me if I did not say it right. I'm terrible with names. And thank you for being here. And you can let you.
Thank you. All right, good. Not afternoon, almost afternoon, everyone. Thank you all for having me. My name is Mariela Sanding. Pronouns are she, hers, and I'm the coordinator for the Contra Costa County Meds Coalition. So MEDS is actually an acronym. It stands for Medication Education and Disposal Safety. Kind of a mouthful, but basically we're a community-based coalition contracted by the Contra Costa Health, Alcohol, and Other Drug Services, so under the Behavioral Health Division, to provide community prevention, primary prevention, in order to prevent substance use disorder and subsequent overdose. Now, as most of us know, the fentanyl crisis is at its peak right now, and so that's really what we've been focusing on mainly in our coalition, and I'll be talking to you all a little bit about the linkage between substance use disorder and mental health, and also ending with an overdose rescue training. Okay. I also want to note, I'm going to be kind of flying through these slides, but I welcome you all to ask questions through the parking lot, and we can try to get to them at the end. Okay. So starting with a little bit of background, just so we have a little bit of foundation. In the year 2022, over 109,000 people in the US died from any drug-related overdose. This includes any drug, even alcohol. That averages to about 300 deaths per day, and of those deaths, almost 83,000 of those involved opioids, otherwise known as painkillers. Now, this percentage that opioids takes up as far as drug overdoses is unfortunately not surprising here in the US. The US uses up to 80% of all opioids that are made throughout the world. We know about the opioid crisis in the 80s and the overprescribing and the misinformation surrounding its likelihood for addiction, which we'll talk about more later. But that's why our numbers, especially in the US, have been very, very high. Now, historically, overdose deaths, especially including opioids, has historically affected young adults, so around ages 18 to 35. However, we've seen a 109% increase among adolescent overdose deaths from 2019 to 2021, okay? Now, to hone in a little bit more on Contra Costa, this graph comes from the California Overdose Dashboard. It's publicly available if you Google it yourself. Essentially, you can filter by county, as well as year, as well as the specific drug that you want to analyze. So for this graph that I pulled, I specified fentanyl-related overdose deaths in 2022 for Contra Costa County. I don't know how clearly you all can see this, but there's been a pretty significant uptick from 2019 up to 2022, right? The numbers just about double. Does anyone have any guesses as to why there's been that increase around that time period? COVID, right? The pandemic was an immensely stressful time for people, right? And we also need to consider those who were either in active substance use disorder, in short-term recovery from substance use disorder, long-term recovery. They were at higher risk for relapsing and subsequently dying of overdose. Maybe they lost that same support system that they once had before the pandemic. Isolation was a really stressful time for them. They might know that self-medicating works for them, and so they've turned back to that. And that's why we've really seen that significant increase, okay? And more specifically, there have been 169 opioid overdose deaths in 2022 alone here in Contra Costa. Okay, so there are some risks associated to developing substance use disorder, and one of them is the linkage between mental health and substance use. Now, I apologize, I'll be using my phone because I have some specific data points that I don't want to get wrong, okay? So, mental health and substance use is often referred to as a co-occurring disorder or dual diagnosis, right? And the interaction between these two disorders worsens the courses of the diseases, okay? Substance use can trigger depression, anxiety, and even psychosis. And the two most common substances that we're seeing in relation to these is alcohol use and cannabis misuse. Now, some of the mental health disorders associated with those substance uses include depression, anxiety, and even PTSD, okay? Many who experience trauma, any layer of trauma, whether that's in their childhood or adulthood, may turn to substances to try and cope with that, okay? It's important to know that substance use disorder is complex, it's chronic, and it can cause deterioration to both your brain and the body, okay? Essentially, when people are self-medicating, they're trying to seek relief, right? It's a mode of survival for them. And it's important to know that there's a lot of stigma surrounding talking about mental health in and of itself and substance use in and of itself. So imagine talking about the two at the same time. It can be really, really difficult for an individual. Sometimes they may not even identify the other side of it. Maybe they have an existing mental health disorder. They're starting to use cannabis because they think it's helping. They don't know that they've developed a substance use disorder. The same can go the other way, where someone has a substance use disorder, but they don't have a diagnosed mental health condition, okay? All right, so we're gonna go a little bit more into depth about what these drugs are, what I'm even talking about. Like I mentioned earlier, my coalition, our expertise is really in prescription drugs, so that's what I'll be focusing on. If you have questions specifically on alcohol and cannabis, I will try my best to answer them, although I have some colleagues that are more experienced in that area. Okay. So, the three types of prescription drugs we'll be talking about are prescription opioids, otherwise known as painkillers, stimulants, sometimes referred to as study drugs or diet pills, and the last is CNS or central nervous system depressants, also known as sedatives. Okay, so there are other types of prescription drugs beyond these three, but these are the three that we'll be talking about because they're the three most commonly misused types, especially among youth. Okay, so starting with stimulants, that can look like Ritalin, Adderall, Dexedrine. How many of you have heard of at least one of these before, just by a show of hands? Right, so these are pretty popular names of pills, right? Like the name says, it's meant to stimulate the central nervous system, right? Adderall is probably the most popular one out of these. It's probably why most of you raised your hand. Adderall is commonly prescribed to individuals with ADD or ADHD, so some form of an attention deficit disorder. And so their doctor, primary care provider, prescribes them Adderall in order to sort of mitigate the feelings of their condition and help them go about their day to day more quote unquote normally, or they can manage themselves a little bit better. Now, they're also referred to commonly as study drugs because, at least when I was in college, I had a lot of classmates that were diagnosed with ADD or ADHD, so that means that they had their prescription of Adderall with them, but they would deal or share their pills with their classmates, marketing it as a study drug. This Adderall is going to help you study longer, study harder, and in turn get better grades. Now, what student doesn't want good grades, right? So they take this pill unknowingly because they hear from their friend that it helps them go about their day to day better. They know that their friend is doing really well in school and they also happen to be taking this prescription pill. But the issue is if they aren't actually diagnosed ADD or ADHD themselves, this medication can be very dangerous to both their brain and body, especially if they're at their developing age, which is anyone under the years of 25. Okay, so that's almost everyone that we work with, right? Some of these negative effects can occur by misusing stimulants, but the most common one that I saw, especially with Adderall, was chronic insomnia. So, like I said, it really stimulates the brain, which can almost mimic the effects of caffeine, which I'm sure some of us know what that feels like. But I remember that there were students taking Adderall recreationally in order to stay up for up to 48 hours to study for exams. And we know how important sleep is for our mind and body. Yeah.
For the person who is not diagnosed with, like, for example, ADHD, or for that person. So those effects are for, like, if I don't have ADHD and I take the drug, this is what happens.
Yes, so these are the negative effects that can occur if someone were to take this medication but they weren't prescribed it, or if they were taking it not as prescribed. So some people can actually be prescribed any of these medications that we're going to talk about, but it can lead to misuse, it can lead to addiction or substance use disorder, and people are taking more than their doctor has advised them to. Okay. All right, so the next is sedatives or central nervous system depressants. And again, like the name says, this is meant to sedate the central nervous system. Alcohol is also considered a depressant, so you can kind of imagine what those sort of depressant feelings might be in the body. With Valium, oh, it's a little cut off, sorry. Valium, Ambien, and Ativan, Those medications are commonly prescribed for a variety of sleeping disorders, so chronic insomnia, maybe trouble falling asleep, staying asleep, oftentimes after a procedure if someone's in a really high amount of pain and they need help getting that regular sleep to help them heal faster. Those medications might be prescribed to them. Xanax is common for a panic or anxiety disorder, where again it helps them slow down their central nervous system and helps them mitigate their disorder a little bit better. Okay. Now, unfortunately, we're seeing a lot of Xanax misuse among youth for the sake of feeling really drowsy, feeling lethargic, almost mimicking the effects of being drunk or intoxicated, but to an even more serious degree or more intense degree. Now, the issue with taking these sedatives recreationally is that, again, these negative effects can occur in the body, okay? Generally, sedatives aren't prescribed to individuals for long bouts of time because it's so easy to become reliant to the effects of them, which we know turns into a substance use disorder, okay? I also want to mention that when youth or young adults are misusing Xanax, sometimes they'll refer to their high off of it as being barred out. That specifically refers to that bar shape of Xanax at the top left. The other issue is that the pill is made to look like it's almost portioned out. So they think that by only taking a fourth of it or a half of it, they'll be fine. When really that's not the case. It depends on the individual themselves and whether or not they actually have the diagnosed condition to be taking these in the first place. Okay, now the next is painkillers or opioids. Okay, so that can look like OxyContin, oxycodone, Vicodin, codeine, Percocet. How many of you have heard of at least one of these before? Right, they're super common, right? Again, and I'm kind of repeating myself, but like the name says, it's meant to kill a really severe amount of pain, right? So oftentimes opioids are prescribed for someone who just went through a pretty intense surgery, an operation. Maybe they're in an advanced stage of pain where something over the counter just won't cut it, right? So they need something stronger than Advil, Motrin, Tylenol, etc. Now, like I mentioned earlier, there was the opioid crisis that started in the 80s when pharmaceutical companies really introduced opioids to the world of prescription medications, marketing them as non addictive, as completely safe. And unfortunately, we're still seeing the effects of those lies today in 2022. Okay. There are people who are still living with opioid use disorders due to that misinformation. And so, really, what's true is that these are super highly addictive, and that's why the prescription levels have actually gone down significantly for opioids. I think doctors are even kind of scared to prescribe them at this point because of the likelihood of causing an opioid use disorder in their patient. But if they're prescribed at all, they're again prescribed for very short amounts of time, okay, on an as needed basis. I remember when I got my wisdom teeth removed, I was prescribed a little bit of opioids. My doctor said, take ibuprofen if you can. If you absolutely can't handle the pain, take as needed, right? I think that's sort of a universal experience now. But again, when people are misusing these for the sake of feeling drowsy, feeling euphoric effects, again, because the purpose of these medications is to erase pain and replace it with better feelings, right? With euphoric feelings, with a total erasure of that pain that they were feeling before they took the medication. And so it's important also to note that addiction, opioid use disorder, the blame can't be pushed all on the individual, okay? A lot of opioid use disorders that occur happen at first with a legitimate prescription from their doctor, okay? After those 30 days are up, their 30-day prescription is over, their mind and their body could have easily developed a reliance and so on, an addiction to these opioids because their mind and their body just they believe truly that they need it to survive in order to feel comfortable day to day. Okay. Now, some of those negative effects can include extreme drowsiness, some uncomfortable constipation, and even slowed or stopped breathing. Now, I want everyone to try and remember slowed or stopped breathing because that's also the number one sign to look out for if someone's overdosing on an opioid. Okay, now fentanyl. I know this is a really hot topic right now. It's on the news at least once a week, right? And so my job as the coordinator of the coalition is to try and stay up to date with what's going on with fentanyl and also bring awareness to the community that this is an issue that's here in Contra Costa and try and answer any questions that you all might have about it. Okay, so fentanyl is considered a synthetic opioid. Now, when they say synthetic, that basically means it's completely made in a lab. None of the ingredients are naturally derived. It can essentially be made in a lab, not out of thin air, but just with a few chemical bonds, right? My background's not in chemistry, so I apologize. But that being said, it's super easy for fentanyl to be made, which in turn, they're able to make the strongest opioid, the most potent opioid possible. Okay, fentanyl is basically the strongest opioid that someone can be prescribed right now. And it is prescribed, again, for very severe amounts of pain. I've learned more recently that fentanyl is being used in an epidural. So when a person is about to give birth, it's given for really intense surgeries, like after a hip replacement, back pain, or for advanced stages of cancer pain. Okay. Now, because fentanyl is so potent, what doctors have figured out is the safest way to give it to their patients is with a microgram amount. Okay. Microgram amount, you can barely see that with the naked eye. Again, it's a really small amount. For reference, a general dose of ibuprofen, so like Advil, is about 600 milligrams, okay? While fentanyl is being dosed in micrograms, okay? So just totally different side of the scale. That will usually come in an injectable form, transdermal patch form. So if you've ever seen someone wear like a nicotine patch or a birth control patch, it's kind of similar, or even a lozenge, so orally, okay? So there's that side of fentanyl, right? Medically prescribed fentanyl, microgram amount fentanyl, that's being highly monitored by the doctor that's prescribing it to you, okay? Now, there's this other side of fentanyl, illicitly manufactured fentanyl, illegal fentanyl, fake fentanyl, whatever you want to call it. That's really what's driving that scary increase in opioid overdoses that we looked at the beginning of the slides, okay? Now, this illicitly manufactured fentanyl usually comes in a white powder form, like that picture on the left. And with this white powder form, people who deal illegal drugs are taking this powder and they're able to press it into virtually any pill shape that they want. Okay, so they can make it look like Adderall, they can make it look like Xanax, they can make it look like Percocet, ecstasy. We're seeing it show up mainly in prescription pills. However, it can be easily masked into other drugs that are available illegally. So powder cocaine, because it's also a white powder, can be liquefied and put into heroin when people inject heroin, so on and so forth, okay? Now, the issue with using fentanyl to lace these pills is, like I said, it's super potent, right? In fact, the amount that it takes to actually send someone into an overdose and possibly a fatal overdose is 2 milligrams, okay? Like I mentioned earlier, ibuprofen, general dose, 600 milligrams. the amount of fentanyl it takes to possibly send someone into a fatal overdose, 2 milligrams. Okay, so that's the size of Abe Lincoln's beard on the penny. In a test tube, it's a couple grains of salt. It's a fraction of a raindrop. It really doesn't take much, which is unfortunately why we're seeing so many accidental overdoses by fentanyl. Okay. So this picture on the left compares an authentic oxycodone pill. Sometimes they're called oxys, blue 30s, M30s, blues. And on the right is a fake or fentanyl laced oxy pill. Okay. Now we don't know how much fentanyl is actually in that pill on the right. Could be 2 milligrams, could be more. Now, if we took those labels away on the picture, could we tell which one was fake or which one was real? Does anyone have any guesses? Right, that's kind of the point, right? So the Drug Enforcement Administration, or the DEA, created this sort of comparison just to show that, for lack of a better word, people who deal drugs are getting really good at what they do, in the sense where they can make these pills look, feel, smell exactly the same as legitimate prescription pills that can be bought at a pharmacy. Okay. In fact, the DEA came out with new data at the end of 2023, stating that 7 out of 10 pills that they seize and test in their labs had a lethal amount of fentanyl. Okay, so that means 70% of the pills that they were seizing were fake, were fentanyl laced. Now, again, just to really emphasize how strong fentanyl is, it's about 50 times more potent than heroin and up to 100 times more potent than morphine. Okay. Heroin and morphine are already considered pretty strong opioids on their own. Okay. Unfortunately, fentanyl is just leaps above it. And with this illegally made fentanyl, there are now, unfortunately, what we call fentanyl analogs, which is kind of just a fancy way of saying subtypes or subcategories of fentanyl. So again, because it's synthetically made, people who deal drugs are able to change tiny parts of the chemical makeup or chemical components of fentanyl to potentially make more potent ones. Okay, so the most common fentanyl analog we're seeing right now is carfentanil, CAR instead of a Y in fentanyl, it's an I. That carfentanil that we're now finding in fentanyl laced pills is up to 100 times stronger than the medically prescribed fentanyl. Okay, so it's really unfortunate, and it's unfortunately present here in Contra Costa. I know this is a lot of information to kind of take in at once, but really, if there's one thing that you can share with a colleague when you leave today, or share with a friend or family, is that the only way to know if a pill or a drug that we're taking is safe is to get it from a legitimate pharmacy or from a legitimate prescription from our doctor. Okay. If we're purchasing anywhere besides those two means, we have to assume at this point that that pill or that drug is either laced or completely made with fentanyl. Okay. All right, so we have all that information. Now, what are some things we can do to keep our kids safe, right? To keep each other safe, our families safe. The most important tool we can have, and you will have when you leave today if you choose to take one, is naloxone, okay? Naloxone is the medication that reverses any overdose on opioids and opioids alone, okay? Narcan is the brand name for the nasal spray that holds 4 milligrams or 1 general dose of naloxone inside of it. So Narcan is more commonly known just because the nasal spray is most publicly available. That's usually what people are able to use on other people. But there is also injectable naloxone that EMTs will use or medical professionals will use. Narcan is what I have for you all today to take home. So I'll be focusing on how to actually administer that on someone. Okay, so in order to actually rescue someone from overdose, we have to know what signs to look out for. Like I mentioned earlier, slow, stopped, shallow breathing is the #1 indicator. When someone has an excessive amount of opioids in their system, it blocks any oxygen from reaching their brain, which we know causes someone to pass out or lose consciousness. Okay. Some of these other signs can show up, like discolored fingernails or lips, depending on their skin tone. If you've ever felt like cold, clammy skin, this is also a telltale sign. They might even be making like a choking or snoring sound, again, because of that lack of oxygen. Okay. Not all of these signs have to be present, but again, remember those two main indicators. So, if you've noticed these signs in an individual, the most important thing to do is wake them up. Okay, try and wake them up. Shake them by the shoulders, shout their name. You can even give them a sternal rub. So if you take your knuckles and you kind of rub it back and forth on their chest bone, it's pretty uncomfortable, even when you do it on yourself. So, if at that point they're still unresponsive, that's a pretty good indication that they need more help. Okay. Now, I'm not going to speak to your school's specific protocol. I encourage you all to ask your administrators about that. But I know that there is new legislation requiring that every school campus have at least one dose of naloxone readily available. Okay, so generally you want to call authorities, right? Call 911. That person needs medical attention as soon as possible. Okay. This is more so in the case that you're rescuing someone and maybe you know that they've taken an illegal substance, or you know that they might not have the best history with law enforcement, with first responders. So it's really important that when you're calling 911, you're not saying, I know someone that took this illegal substance, now they're passed out. They might be more ready to send police officers rather than an ambulance. And in this situation, that person needs an ambulance. Okay, so if you need to be broad, be broad. Call 911, say, I have someone who's unconscious, they need an ambulance. Can you please send one? Okay. At that point, you need to administer the Narcan as soon as possible. If there are multiple people on the scene, have one person call 911 and the other administer the medication. So, how many of you know how to give CPR? Awesome. Okay, so I'm not certified to train people to give CPR, so I'm not going to go super into depth about it. But if you're familiar, you would lie the individual on their back with their chin slightly tilted up in order to clear their airways. Okay, you can use the back of their neck, hold the back of their neck to keep their chin tilted up. At that point, the Narcan's really easy to administer. It comes in a peel back packaging. And what you want to do is hold the device exactly like that picture. So with your second and third finger on either side of the nozzle or the long tip. Once the nozzle is inserted into either nostril, doesn't matter, push the pin or the trigger with your thumb firmly. The trigger will make a clicking sound and it won't sort of go back in place. Wait a couple of seconds and then take the device out of the nose, okay, just to ensure that everything has been sprayed up there. At that point, assess the person, see if there's any changes in their signs, and perform CPR if you know how. Okay, so chest compressions, mouth to mouth, for the next 2 to 3 minutes. Okay, if after 2 to 3 minutes since giving that first dose of Narcan and giving them CPR, they're still unresponsive, they still haven't improved, you need to administer a second dose of Narcan. Okay. Now, that second dose of Narcan happens with a completely new device. It's important to know that each cartridge or device only holds one dose or one spray. So once you've clicked that pin once, you cannot use the same one again. The person requires a second dose, open up a completely new packaging. Now, this process of administering Narcan, giving CPR for the next 2 to 3 minutes, repeats until the person revives. Okay, that's key. Unfortunately, we're seeing with fentanyl overdoses that it's taking at least 2 doses of Narcan to revive the person, if not more. So that's why we say call 911, because if all you have is 1 or 2 doses and the person requires 6, EMTs will be on their way with more than enough. Okay, if you don't have Narcan, don't know how to give CPR, the best you can do is call 911, place them in a rescue position. Okay, so that's on their side, preventing them from being on their back. There is a pretty high chance that they could foam at the mouth or vomit, and so we want to make sure that that stays out of their airways as much as possible. And lastly, monitor them, right? Do not leave them alone in any case. We talked about earlier, warm handoff. We want to make sure that we're staying with them at the very least until the paramedics arrive. Okay, just a few things to note about naloxone. It lasts about 30 to 90 minutes in the body, meaning that the person has a chance of overdosing again, even after they've revived. Okay. While the medication does its best to wipe out existing opioids in the system, it lasts for 30 to 90 minutes, while opioids last 6 to 8 hours in the body. Okay, so even after, let's say I've rescued someone after 2 doses, they woke up, they're feeling fine, they're saying, I really don't think I need to get into an ambulance, I'll just lie down for the rest of the day. You need to let them know that for the next 6 to 8 hours, they have a chance of falling into an overdose again. Okay, if they're really adamant about not getting into an ambulance, at the very least, stay with them for that period of time. I'm going to skip ahead to that bottom. It's really important to know that naloxone is formulated to be really safe, meaning that you cannot hurt someone by giving them naloxone if they're not overdosing on opioids. Okay, so let's say that we came across a student that was passed out in the bathroom, right? Their breathing was really irregular. You're sort of trying to use your context clues as best as you can. You know where your Narcan is located on campus. You've notified authorities. You're like, I really think I should give them Narcan. You give them Narcan, the ambulance shows up. They determine that it's something completely unrelated. They don't have any opioids in their system. You have not created any long-term damage to their brain or their body by giving them naloxone, okay? I could spray naloxone into my nose right now. The worst I would feel is maybe nauseous for about an hour, okay? But I would be completely fine because I don't have any opioids in my system for naloxone to wipe out in the first place, okay? So I always say, when in doubt, please give naloxone because you could potentially save a life, okay? Naloxone is safe to use on babies. In fact, smaller doses are given to babies when they are delivered and they come out in withdrawal due to the person that was carrying them. Maybe they had an opioid use disorder. It can be given to dogs, right? There are sometimes when you're walking your dog, they might come across something on the floor and take it. You can give it to your dog, okay? You can give it to toddlers, all of that, okay? Okay, I'm not gonna go too into depth about this. Again, we have our free overdose rescue kits for you all to take home before you leave today. That includes 2 doses of naloxone, which means 2 cartridges of Narcan, a pair of non-latex gloves, as well as a CPR mouth guard. So it's a small sheet you can put over someone's mouth if you want to give them mouth-to-mouth breathing. I, again, would encourage you all to find out where your Narcan is located on campus in case of an emergency. Okay, just some last things before we end. This is another DEA saying one pill can kill, right? Unfortunately, kids don't have the quote unquote luxury of experimentation of street drugs in the way that we did in prior decades. The likelihood that they will come across a fentanyl laced drug is too high for us to take that risk, okay? Up and away, another thing that our coalition advocates for is safe medication storage. We know that overdose can sometimes happen in the home due to easy access to prescription medications. So if you have any prescription medications at home and you have children, whether they're smaller or in their teen years, it's important to keep those stored properly, okay? Have a plan. I'm hoping that you all stop by that table where you all signed in this morning and take a kit with you when you leave. All we ask is that you write the kit number of your assigned kit next to your name on the sign-in form. Okay, there'll be people there to help you sign it out. And lastly, be a trustworthy adult, right? I know this was sort of mentioned in the previous sections, but it's really important to create that environment where your students feel safe enough to come to you and talk to you if they have a problem or if they just have a question about substance use. That one conversation that you open up for them could potentially save their life. Okay, just some last resources. The county offers a 24-hour behavioral health access line. You're welcome to take pictures of the slides or I can send them to you after. But this number can be called for anything mental health or substance use related. I know that there are some school site mental health professionals that know how to walk a student and or parent through this access line so they can receive specific care like treatment, educational resources, etc. Now, give me a second to pull this up, but I also have a direct line if you all are looking for one. Her name is Marissa Monterosa. I have heard on a couple occasions that sometimes with the access line, there's a long wait. It's hard to talk to the operator. There's a lot of back and forth. And so Maritza is contracted by Alcohol and Other Drugs to help parents and youth to contact substance use prevention, treatment, and resources for ages 12 to 17. Okay, and Maritza also does offer Spanish translations, so she's really the personal contact for individuals who need that warm handoff to anything substance use related. Okay. I also put her email there too. Okay, lastly, that's my contact information, as well as Jessica, who's works alongside me through the county. Again, all of our resources and education from our coalition are completely free because we are contracted out by the county. So if you know of any organization, group, maybe it's PTSA, that's interested in receiving this information and this Narcan training, overdose rescue training, please contact me and let me know. I'd be happy to set something up in any mode, whether that's virtual, in person, or hybrid. The only thing we ask is that you fill out a really short post-presentation survey in order to get your feedback about how this presentation was received, how informative it was for you. And again, I welcome you all to ask me any questions afterwards or utilize the parking lot.
There's going to be a recording of this training on our website. We'll send that as well. Yes.
Right. Well, I want to thank you all for your time and attention, and for Edmund for inviting me to join you all today.
Thank you. Thank you. Thank you. I just want to remind everyone to please take care of themselves today. This was a lot of information that we gave you all. That concludes our training today. If you want to stick around and ask us any questions, I do see some questions on the parking lot, but I do want to be mindful of your time. We will get to those questions in our follow-up email. If you want to come up and talk to us and have a conversation, we can have a conversation as well. Thank you for being here with us. Again, like I said, if you want us to come out to your school districts, we can. And I think we have one last thing.
And please, you're all invited to a school-based mental health collaborative, which will be on February 1st, Thursday, February 1st.